There are many types of spinal problems. The most common ones that we usually see are the degenerative ones or the lifestyle ones. The problems that come up with age, as and when the spine starts degenerating with the excessive or wrong usage of the spine. So that most commonly occurs in the neck region, where we call it the cervical region, and the layman term is cervical spondylitis, which is technically not correct. Similarly, we have a backache or low backache in the lumbar region, which we call as lumbar spondylosis or lumbar degenerative disease. So they may present to you as just a neck pain or a low backache that starts getting worsening with time, that worsens with activity. Maybe you wake up in the morning, it's more, and during the day it may improve. So these are the degenerative changes are usually because of lifestyle problems. Lifestyle for the low back ache is most common is the sedentary lifestyle and an increasing weight, especially the protruding belly. And people tend to sit for about 10 hours, 16 hours at their work, and then no exercises, that leads to these problems. Secondly, after the work hours, people are busy with their mobiles and we see them working like this. You see the neck is flexed at almost 80 to 90 degrees, and prolonged usage of this mobile has also led to the neck pain and the neck degenerative diseases increasing. We have seen this age group, which we usually saw it around 45 to 50 years of age. Now it's come down to say 25 to 30 years of age. People have started to complain of neck pain and neck issues. Spinal disc problem is the problems that are related because of the disc prolapse. The disc is normally of two parts. One is a very tight fibrous and a soft jelly inside. The function is it acts as a shock absorber between two vertebrae or the bones. Due to excessive usage, wear and tear, abnormal posturing or trauma, the capsule part may rupture and the disc or the soft part comes out. Once it comes out, there's a change in the curvature of the spine that can cause pain in the neck or the low back depending on the area where it has come out. If the disc goes to one side and presses a nerve root, then we have something called as a radicular pain. Then the pain would start in the neck and go down the arm, or start in the back and go down the leg. So these are the disc problems that can happen because of the disc coming out. Rarely, if it's a sudden event or maybe there's a massive disc that has come out, it can even lead to paralysis or loss of control over urine or bowel. The worsening of a spinal problem is one, the pain keeps on increasing on a daily basis or a weekly basis. Two, there are new symptoms that keep on increasing. Initially, if we have a neck pain, and then after a few days you have the pain going down the arm, that means it's increasing. Maybe the disc has come out, maybe the disc is compressing the nerve, then you need to consult your doctor. Similarly, for the low back, any pain that was there only in the low back region but later on starts going towards the legs or the feet, or you feel some tingling sensation under the sole, means the disc has come out, the nerve is getting compressed. You need to consult your doctor. The treatment option depends on the patient's conditions and how severe the symptoms are. We usually investigate it by clinically evaluating the patient and maybe doing an imaging like an MRI and an X-ray. Depending on that young patient, we usually try to avoid surgical intervention. We start with medicines and exercises and physiotherapy. In case they don't improve with that, then we may require to do some pain procedures like giving injections in the spine. And in case they do not improve even after that, we may require to do surgery. Sometimes the patients may come with so significant symptoms that we have to do the surgery as the first step also. Add on with it some rehabilitation procedures. Rehabilitation can be exercises that are done by the patient, or maybe they can be assisted rehabilitation, like we have the robotic rehabilitation nowadays, which can be used for before the surgery, after the surgery, or in case it's a case of say paralysis. These robotic rehabilitations are really helpful in such patients.